Is it possible to treat neuropathic pain without medications and without surgical intervention like spinal cord stimulators and get long-term relief? Well, in this video, we're going to talk about Scrambler Therapy, a therapy designed in Rome, Italy to treat just that. So let's get down to it. What is Scrambler Therapy? Scrambler Therapy literally scrambles the signal coming from the painful, noxious stimuli, whether this is a cancer pain or a neuropathic pain process like peripheral neuropathy, interrupts that painful signal that's being sent to the brain, scrambles it with a synthetic transmission to retrain the brain to sense a no pain signal. That's how Scrambler Therapy works. This is an extremely sophisticated machine. This is drastically different than a TENS unit. Can only be applied in a physician's office under the direct supervision of a physician. So this is not something that you can buy and take home with you. The Scrambler machine uses a proprietary, of course, type of technology that scrambles this signal into 16 different pathways in order to come up with the perfect signal that can help reprogram that signal to your brain. This treatment was FDA approved originally in 2009 and is being used at some of the top institutions in the world. In the United States, this has been studied extensively at Johns Hopkins University. A recent review was done in the New England Journal of Medicine. It's being used at the Mayo Clinic, the Cleveland Clinic in Ohio, as well as Baylor Medical Center or Baylor College of Medicine in Houston, and at the world famous MD Anderson Cancer Center for research and treatment for cancer patients. So when is Scrambler Therapy indicated? We use Scrambler Therapy on two different types of patients. One would be the neuropathic pain type patient, and then number two, the cancer pain type patients. Number one, what is neuropathic pain? Neuropathic pain just basically means nerve pain. What this basically means is they're having some type of nerve-related pain. Now there's all different kinds of peripheral neuropathy. The most common we see is no known cause, or what's called idiopathic neuropathy. Idiopathic neuropathy means that we don't really understand why the patient is having peripheral neuropathy, but they have pain coming from the nerves with, like I said, no known cause. The second type of peripheral neuropathy we see is chemo-induced peripheral neuropathy. So these are patients who have undergone chemotherapy, and the chemotherapy medications have literally damaged the myelin sheath, or that protective insulation of the nerve. And now, because of the exposure to the surrounding tissue, now we're seeing abnormal signals being sent to the brain, and this is causing burning, numbness, tingling, and obviously severe pain sometimes. A couple of other types of peripheral neuropathy would include diabetic peripheral neuropathy, so uncontrolled diabetes, high blood sugars or high glucose levels in the blood, damaging that myelin sheath as well. And then alcohol-related peripheral neuropathy. So this is patients that have consumed large amounts or large quantities of alcohol, especially binge drinking, and the alcohol itself, being the poison that it is literally damaging the nerve sheath or damaging that myelin sheath, causing increased pain, burning, numbness, tingling, the same things that we see with pretty much all types of neuropathy. Another super painful condition that we see is complex regional pain syndrome. CRPS, or allodynia, the symptom of allodynia, severe increased pain to what otherwise normally should be a normal sensation, like maybe just clothes touching your skin, or maybe somebody coming and touching your skin or shaking your hand. And this can be induced by all kinds of things, but especially sometimes like a crush injury or surgery sometimes, or some other type of trauma. Another condition that can be treated with Scrambler Therapy is post-herpetic neuralgia, or shingles pain. So sometimes after shingles, we develop these significant chronic pain syndromes that can be very challenging to treat. Phantom limb pain can also be treated with Scrambler Therapy. Now we get into some of the other types of neuropathic pain, like sciatica, or severe back and neck pain related to pinched nerves in the spine. These are also forms of neuropathic pain. Patients that have had multiple back surgeries and pain management doesn't work anymore. The pain medications, the opioids, the gabapentin, the pregabalin, when these medications are failing to relieve the pain, Scrambler Therapy is potentially a fantastic treatment option, because there's no pharmacologic intervention, there's no medications used, there's no surgery considered. And finally, for patients that have endometriosis, so something that we don't think a lot of, This is typically oftentimes seen in younger individuals, younger women that have endometrial lining that is actually growing in different parts of the pelvis. This can be extremely painful, but Scrambler Therapy has been shown to be very effective at treating endometrial type pain. Scrambler Therapy can offer hope to these patients that are suffering from these very difficult to treat neuropathic pain conditions. So last, we're going to talk about cancer pain and the different types of cancers that can be extremely painful and very, very challenging to control pain in these patients with these different types of cancers. Number one, metastatic bone cancer. So when the bony lesion is either pinching on a nerve or expanding the bone tissue itself, bone is highly innervated with nerve endings. So as that bone expands, it can be extremely painful. Second is pancreatic cancer, one of the most painful cancers known to man. Third, head and neck cancers. And last, just some different brain cancers and just nervous system related tumors. So when the tumor tissue itself is in the nerve tissue, it can be extremely painful. So if you've been suffering from neuropathic pain or, God forbid, a cancer-related pain, and your pain is not being well controlled with pain medications or the nerve pain drugs, or you've had procedures and those have failed, call Texas Spine Clinic today, get scheduled for a consultation, and see if Scrambler Therapy is right for you.